What happens if we drink turmeric every day? For many people, this is an interesting question since turmeric has been used for centuries in Ayurvedic medicine for various health issues. However, it's important to note that not all studies show positive results for turmeric, and some even suggest potential negative effects. One study found that curcumin supplementation improved cognitive performance in healthy middle-aged adults after 4 months. Another study showed that curcumin may be effective in reducing the risk of Alzheimer's disease by inhibiting the formation of amyloid plaques in the brain. Additionally, curcumin has anti-inflammatory properties that may help reduce inflammation in the brain and protect against oxidative stress, which can contribute to neurodegeneration. A study showed that curcumin supplementation was effective in reducing symptoms of IBD, including abdominal pain and fecal frequency. Additionally, curcumin may help prevent the formation of ulcers by inhibiting the growth of Helicobacter pylori, a bacteria that can cause stomach ulcers. Some studies also suggest that curcumin may help improve liver function and prevent fatty liver disease. However, most studies investigating the health benefits of turmeric have used doses ranging from 1 to 3 grams of curcumin per day. While turmeric is generally considered safe for most people when used in recommended amounts, there are a few groups of people who should avoid or use it with caution. The active compound in turmeric, curcumin, has been found to inhibit the activity of certain enzymes involved in drug metabolism. When using turmeric in cooking, it's important to use a generous amount since the active compound curcumin is poorly absorbed by the body on its own. While the available evidence suggests that turmeric may offer several health benefits, including improved brain function, heart health, cancer prevention, and digestive health, it's important to note that not all studies show positive results, and more research is needed to fully understand its efficacy and safety. Additionally, turmeric may interact with certain medications or have negative effects in some individuals. As always, it's essential to consult with a healthcare provider before starting any new supplement or making significant changes to your diet or lifestyle. It can help you determine the appropriate dosage, identify potential risks and interactions, and ensure that turmeric is safe and suitable for you. Remember, turmeric is a supplement, not a medication, and should be used as part of a balanced diet and healthy lifestyle. Thank you for watching, and stay tuned for more informative videos. One way to improve the bioavailability of curcumin is to consume it with black pepper or piperine, which can enhance its absorption by up to 2,000. Additionally, consuming turmeric with a meal containing some fat may also help improve its absorption. Turmeric tea is another popular way to consume turmeric, and it can be made by boiling turmeric rhizome in water and then adding lemon juice and honey to taste. You can also use turmeric in golden milk, a traditional Ayurvedic recipe made with turmeric, ginger, cinnamon, and coconut milk. Golden milk is believed to have anti-inflammatory and antioxidant properties and can be enjoyed warm. Finally, turmeric supplements are available in various forms, including capsules, tablets, and powder. It's important to follow the recommended dosage on the product label and consult with a healthcare provider if you have any concerns. This means that curcumin may interfere with the breakdown of certain drugs in the body, leading to higher levels of those drugs in the bloodstream. As a result, curcumin may cause some commonly used drugs to stay in the body for longer than expected, potentially resulting in a false positive on a drug test. It's important to note that the amount of curcumin required to produce this effect is much higher than the amounts typically found in food or used as a supplement. However, it's still possible that very high doses of turmeric could potentially lead to a false positive drug test. Therefore, it's best to avoid taking turmeric supplements or consuming large amounts of turmeric in food before a drug test. If you have concerns about whether turmeric or other substances may affect your drug test results, it's important to speak with your healthcare provider or the testing facility beforehand. They can provide guidance on what to avoid before the test and help ensure that you receive accurate and reliable results. People taking blood-thinning medications should avoid turmeric, as it may increase the risk of bleeding. Additionally, pregnant or breastfeeding women should avoid turmeric, as there is limited information available on its safety and effects on the fetus or infant. People with a history of or at risk for developing kidney stones should also avoid turmeric, as it may increase the risk of stone formation. If you have any concerns or questions about whether turmeric is safe for you, talk to your healthcare provider. It's important to note that turmeric is a supplement and not a medication, and it should be used as part of a healthy diet and lifestyle. Studies have also shown that curcumin may help improve symptoms of depression and anxiety. It's likely due to its ability to increase levels of brain-derived neurotrophic factor, BDNF, which is important for the growth and development of neurons. Some studies have shown that curcumin may help reduce symptoms of osteoarthritis, such as joint pain and stiffness. For example, one study found that high doses of curcumin supplementation were associated with an increased risk of bleeding, particularly in people taking blood-thinning medications. Additionally, some studies have suggested that curcumin may interfere with certain medications, including anticoagulants, antihypertensives, and diabetes drugs. It's important to talk to your healthcare provider before starting any new supplements, including turmeric, to ensure it's safe and appropriate for you. Other studies have investigated the use of turmeric in treating respiratory infections such as sinusitis and bronchitis. While more research is needed to fully understand the efficacy of turmeric for these conditions, the available evidence suggests that it may have some therapeutic potential. Additionally, turmeric has anti-inflammatory and antioxidant properties that may help reduce inflammation and oxidative stress in the body, potentially benefiting overall health. So let's dive into the research and explore both the potential benefits and risks of consuming turmeric daily. A study showed that curcumin supplementation reduced the risk of heart disease events, such as heart attacks and strokes in people with metabolic syndrome. One study found that curcumin supplementation was associated with a lower risk of developing any type of cancer. Other studies have shown that curcumin may be effective in inducing apoptosis or programmed cell death in cancer cells and inhibiting angiogenesis, which is the formation of new blood vessels that supply nutrients to cancer cells. While more research is needed to fully understand the anti-cancer effects of turmeric, the available evidence suggests that it may play a role in cancer prevention. Additionally, curcumin may help improve blood lipid profiles by reducing total cholesterol and triglyceride levels, while increasing HDL cholesterol. Some studies also suggest that curcumin may help lower blood pressure by improving endothelial function and reducing vascular resistance. Curcumin, the active compound in turmeric, can improve brain function and help prevent neurodegenerative diseases. Heart health benefits. Turmeric contains antioxidants that can help reduce inflammation and oxidative stress, which may protect against heart disease. Cancer prevention. Curcumin has been shown to have anti-cancer properties and may help prevent the growth and spread of cancer cells. Digestive health benefits. Turmeric has anti-inflammatory properties that may help reduce inflammation in the gut and prevent digestive issues such as irritable bowel disease, IBD. Other potential benefits. Turmeric has been used for centuries in traditional medicine to treat various health issues, including arthritis, respiratory infections, and skin conditions. However, it's important to note that not all studies show positive results for turmeric, and some even suggest potential negative effects. Recommended dosage. There is no established recommended dietary intake for turmeric, and the appropriate dosage may vary depending on the individual and the intended use. Who should avoid turmeric? Can turmeric cause a false negative on a drug test? How to use turmeric. Turmeric can be consumed in various forms, including fresh, ground, or in supplement form. Conclusion. Turmeric is a popular spice with a long history of use in traditional medicine for various health issues.